So let's study the bony anatomy of the foot. This is a left foot, and don't be overwhelmed by how many bones are here, because it's really quite simple to remember the names of these bones. And if we remember the names of the bones, we can work out the names of the joints and the names of the ligaments. And this forms the basis of learning muscular anatomy. So we need to know where our tendons insert, where our ligaments run from and to, because these ligaments are very commonly injured. So let's begin. So we'll start with the regions. We have tarsal bones, which are located here, and there's 7 tarsal bones. Then we have metatarsals, and there's 5 of those. So these are the metatarsals. And then you have phalanges, spelt with a PH. Now, how many phalanges do you think there are? So the digits 2, 3, 4, and 5 each have 3. So here's a proximal phalanx, a middle phalanx, and a distal phalanx, which are very tiny. So proximal, middle, distal. So you have 3, 6, 9, 12. But the first digit only has 2, so it has a proximal phalanx and a distal phalanx. And that has implications for the names of the joints. So if we were to name the joints of these digits, we would need to distinguish this joint from this joint. So firstly, they're called interphalangeal joints. And this one would be the proximal one because it's closest to the body. And this would be the distal phalanx. So we can abbreviate it as the pip joint and the dip joint. Now back to the tarsal bones. There's 7 tarsal bones. So what are the names of the tarsal bones? Well, on top we have the talus. And the talus is quite large, and it's the only one that doesn't have any muscular attachments. But it does have special features. So it has a body, and it has a head, which is distal, and therefore it has also a neck. And the body has this big dome shape, which is called the trochlea, and that's what articulates with the tibia. Now the talus sits on top of the calcaneus. So the calcaneus bone, or the calcaneus, is this really large bone, and of course that forms your heel bone. So the calcaneal has a great big tuberosity, and this is where the Achilles attaches and comes down, and the plantar fascia attaches on the plantar surface. And the calcaneus makes up one of the tarsal bones. So the other 5 tarsal bones are located here. Now this is where the names can become a little overwhelming. But on the medial side, we first of all have one called the navicular bone. And after that, there are 3 that have the same name. So if you think of the navicular medially, it navigates 3 more bones. So it's, if you like, it's the leader of 3 bones. So if you can remember the navicular navigates 3 other bones, you'll remember that these have the same name, and they start with the letter C, and they're called the cuneiforms. Now because there are 3 of them, we have to distinguish them. So we call this one the medial cuneiform, and it's the largest, and there are muscular attachments here, and they help hold up the arch of the foot. And then you have your intermediate, and then you have your lateral cuneiform. Now, on the lateral side, we have our last tarsal bone, and it also starts with the letter C. And because it's square shape, it should be easy to remember that that's called the cuboid. So that makes up your 7 tarsal bones. If we look at metatarsals for a second, they have this sort of narrow shaft, and they have a bulbous distal end, which is rounded, and this is called the head. So the heads are the point that contacts the ground at the ball of the foot, and hence why people get pain underneath the metatarsal head at this joint here. So that makes these ends the bases. So the bases are larger, and this is where the weight is transferred from the tarsal bones into the metatarsals, and the heads articulate with the proximal phalanx. All right, so let's talk about joint names. We'll start here because we covered our pip and our dip. So the joint between a metatarsal and a phalanx is simply called the metatarsophalangeal joint, and there are 5 of them. And the MTP joint is reinforced on its inferior surface by a little ligament called the plantar plate. So it sits joining the 2 bones like a joint capsule underneath, and it's attracted a lot of attention from foot surgeons and podiatrists and the world of ultrasound because these plantar plates cop a lot of wear and tear, particularly when people stub their toe, and it can cause a little tear of the ligament under that joint. And the joint's also, being that there's that capsule, that plantar plate, the capsule can become degenerative and it can thicken. We see it on imaging. It can lead to metatarsalgia, which is pain of those joints, and it's quite debilitating for a lot of people. So hence a lot of radiology imaging is aimed at these joints and trying to ascertain the cause of pain in patients. So then there's these joints here between the tarsal bones, like your cuneiforms, and the metatarsals. So these are simply called the tarsometatarsal joints. And they're a source of pain as well. In the aging population or those with arthritis, these joints become very painful. So you can see how the medial, intermediate and lateral cuneiform articulate with the first, second, third metatarsal. And the cuboid, laterally, the cuboid articulates with the 4th and the 5th metatarsal bases. Okay, so those joints are relatively simple. Obviously, with the great toe, we don't have 2 interphalangeal joints. We just have 1. So we simply call it the interphalangeal joint of the first digit. This joint, which is in line with the MTPs of these digits, is called the metatarsophalangeal joint. Okay, so all the MTP joints are underneath the ball of your foot, and they carry the weight at the ball of the foot, and your other interphalangeal joints obviously act to allow movement, flexion of the toes and extension of the toes. Then our joint names up here simply come from the articulations between the bones. So when we talk about relational anatomy, it's important to know what's proximal and what's distal, what's anterior, what's posterior, or what's dorsal and plantar in this case. So the dorsal surface of the foot is obviously this one, so we're looking down on the top of the foot. The plantar surface is the one that's underneath, and I'm actually holding this plantar surface up slightly. So the foot is made up of several arches. They call this the medial arch, which sits quite high. So if we look at a foot side on, it should have elevation medially, like a suspension bridge. And there's also a lateral arch and a transverse arch which runs underneath the foot in this direction. But back to these joints. So the articulation between the anterior head of the talus and the navicular is the talonavicular joint. And obviously there would be a ligament called the talonavicular ligament. Then the navicular articulates with the medial, intermediate, and you can see also the lateral cuneiform and the cuboid. So the navicular touches a lot of different joints. So we would call this the naviculo-cuneiform joint, talonavicular joint, as we said. And then obviously where the talus articulates with the calcaneus, we can say subtalar joint because it's below the talus, but we can say talocalcaneal joint as well. Then you can see laterally, this is the calcaneus, and it's articulating with the cuboid anteriorly. So this would be the calcaneo-cuboid joint. And there is a ligament, and there's also a muscular attachment here. And I want to talk about that muscular attachment because there's a very common injury here. But before we do, I'll just describe a thing called the mid-tarsal line. So we said there was a calcaneocuboid joint here, and this is probably the largest word I'll say today, the talocalcaneal navicular joint. So that means the talocalcaneal navicular joint. So that's this region in here and underneath. Now, those two joints I just mentioned, they combine to form a transverse mid-tarsal joint. So the line across here is called the transverse mid-tarsal joint. And that joint plays an important part in putting the spring in your step, acting like a shock absorber during the push-off phase of walking and running. So you can see how the tibia would articulate here, the lateral malleolus would come down here, the medial malleolus would come down here, and the weight-bearing parts performed here. But across here, you can see how that joint needs to move to provide the ability for the foot to plantar flex and to push off during walking. So we discussed our tarsometatarsal joints, our metatarsophalangeal joints, but what about the joints just between the tarsal bones themselves? So you can see we would just simply call this the intercuneiform joints. And then where the metatarsal bases articulate with each other slightly, so where they touch, we call them the intermetatarsal joints. And then there's obviously interphalangeal joints, but we've already discussed those, interphalangeal joints. So whenever we say inter, we mean between two things of the same name. Now there's features of the calcaneus I haven't mentioned yet, and I will because they're very important. So if we turn medially, you can see this large protuberance on the instep of the calcaneus. And this has a name. This is called sustentaculum tali. And the sustentaculum tali helps to hold the talus in place and for the talus to weight bear against the calcaneus. So if we were to remove the talus, the calcaneus has several facets, and facets are where the bones articulate. So to distinguish the fact that there's three facets, they're really simply named the posterior facet, the middle facet, and the anterior facet. And the middle facet sits on top of this bony protuberance called the sustentaculum tali. And the reason we learn that is because there are several structures that pass around that sustentaculum tali, and it's also a good landmark for finding ligaments of the foot. So if you remember, the medial tendons of the ankle are called Tom, Dick and Harry, and the tibialis posterior and the flexor digitorum pass usually anterior to the sustentaculum tali, but the flexor hallucis longus sits in this little groove just behind it, and of course the flexor hallucis is travelling towards the great toe. Okay. Now, a couple of other features. There's this sinus here called the sinus tarsi, and it does actually communicate right underneath the tarsal joint out to the other side, and that little pathway forms a good nutrient channel for blood vessels, but also this sinus tarsi contains a large ligament which we can't see, which articulates the talus to the calcaneus. And that ligament can be injured in lateral sprain injuries. Whoops, one of our toes has fallen off. And consequently, when we're performing diagnostic imaging, sometimes we see fluid within the sinus tarsi, and it is a gateway to the subtalar joint. So for pain injections of, say if we're performing cortisone injections due to a previous subtalar joint injury, we can aim our needles into the sinus tarsi, and that communicates all the way underneath the talus. Okay, so in a separate lecture, I think we'll discuss our muscular attachments and what inserts on the foot. But for now, hopefully that's given you some of the important names of the foot. In terms of revision, we'll go over the 7 tarsal bones. We have the calcaneus, the talus, the navicular medially and the cuboid laterally. The navicular navigates 3 small bones that have the same name, the medial cuneiform, intermediate, and the lateral cuneiform. Then you have 5 metatarsals, base, shaft, and head, and then you have 15 phalanxes, proximal, middle, distal phalanx, and the great toe just having the proximal and the distal.